If you're a registered nurse thinking about becoming a clinical instructor, then this video is for you. I left bedside to become a clinical instructor, and no one actually prepared me for what I was going to walk into. The pay structure, the contracts, the emotional shift, it was all new to me. So I'm going to tell you because I wish that someone had told me. So if you don't know, my name is Shanae. I am a registered nurse and I'm also a clinical instructor and nursing professor in Ontario. So on this channel, I talk about my nursing career. I've kind of been on both sides, so both bedside and education. And I know what the transition looks like. I know what the job posting doesn't tell you, and essentially what I would do differently if I had to start over. So if you've been searching on how to become a clinical instructor, then you are in the right place. So tip number one, before you apply to that job, before you update your resume, before you look into your credentials, tip number one is about building that foundation. Clinical instructing requires you to teach what you know. So the more foundation that you have, the more experience that you have in assessments, prioritization, medications, procedures, protocols, critical thinking, reasoning, the more natural it becomes. So when a nursing student asks you why you are doing something the way that you are, you need to be able to explain why, give your clinical reasoning and critical thinking behind it, and explain that process. That fluency only comes when you have done the work yourself. You've experienced it yourself over and over and over again. So there's that repetition until it becomes second nature. If you're practicing on the floor already, be intentional about it. Find opportunities to teach new staff, right? Onboarding staff, to be a preceptor, to take in students from colleges and universities that are doing their consolidation on your floor, volunteer to be their preceptor, because that is kind of a pathway or segue into clinical instruction. I find that the nurses who smoothly transition into clinical instruction are the ones who have been teaching and imparting their knowledge on their floor without even realizing it. So build your foundation now because it will make everything that much more easier. If you're a bedside nurse thinking about becoming a clinical instructor, please do not quit your full-time job. At least not right away. So clinical instructor roles are typically part-time and they are contracted, meaning you are employed for 8 to 13 weeks at a time per semester. Some clinical instructors piece together different contracts from different colleges and universities to make up full-time hours. That's actually what I do. However, it's very difficult to do this early on. It kind of happens gradually, and that's kind of what happened for me. It took me about 3 years to be employed by multiple colleges and universities, working different contracts per semester. This is not a reason to avoid the role. It's more of a plan to transition into it strategically. So what you can do is keep your full-time role, maybe scale back your hours, switch your shifts around so that you can kind of transition into the clinical instructor role. And this will give you more financial stability as you build your reputation and relationships within these nursing programs. This approach also keeps your clinical skills sharp because you are teaching and practicing at the same time, which is ideal, right? Sometimes clinical instructors have a hybrid role, meaning that they are working or teaching in the hospital and they're also teaching in the class. You just have to find what works best for you. And so I think by keeping that full-time role as you're transitioning, it gives you some time to play around with your hours, to understand the contracts and how they work each semester, and really build a concrete, solid foundation off the bat. So go in knowing that this is the landscape, plan accordingly so that you're not caught off guard. This tip makes the biggest practical difference for nurses who want to become a clinical instructor, and that is most clinical instructor roles are filled through relationships, unfortunately. Most nursing schools in Ontario, from my experience, hire those who they know or they hire instructors through someone that they trust. Cold application is automatically at a disadvantage versus someone who has introduced themselves. So here's what you can do. Before you start updating your resume, what you can do is reach out to nursing programs through email. So you can look up nursing programs, look up their dean, look up their coordinators, their placement coordinators, figure out who these people are and send them an email. In this email, you are not asking for a job. You are just expressing interest. You're introducing yourself, the email should be really warm. It's just an introduction. So this email puts you on their radar, right? It opens up conversation, a little back and forth, and that's how the relationship is formed. So relationship first, then your application, and then God willing, you get into that role. Nursing programs are not just looking for a nurse. They are looking for someone that can fill a gap, and that is your specialty. So what you want to do is lead with your specialty. So what are you known for? What is your strong suit? Is it med surg? Is it critical care? Is it mat child, labor and delivery, mental health? What is it? Figure it out. This is your value as a clinical instructor, and you're going to lead with that. This immediately makes you useful to the nursing program because they can kind of see where you can fit in their roster. So your specialty is not your limitation, it's actually your edge. So that is something that you want to own and you want to lead with that. Transitioning from bedside to clinical education is not just a career change, but it's a whole identity shift. As a bedside nurse, your identity is tied to direct patient care. It's tied to the fast pace, the hands-on skills, I made a difference in my patient's day to day. That kind of vibe and that kind of feeling. However, as a clinical instructor, your impact is a little different. It's more so slower, it's progression and watching someone else do care. It's about investing in your students for 8 to 12 weeks and then passing them off to someone else and doing it all over again. It's just this constant rotation, this constant cycle. This transition is genuinely, it's deeply rewarding. However, it is completely different and it's an adjustment. There's going to be days where you miss your floor, where you just kind of want to do it yourself. However, you just have to remember that the focus is not yourself. The focus is the student and their learning and their education and them gaining that experience. So your impact again is different. It's about the nurses that you are shaping, right? The nurses that you are supporting, the nurses that you're teaching, and it's not necessarily about the patient. So just go into it with your eyes open and know that the role is different. However, it is completely worth it. So those are all of my tips on how to become a clinical instructor. And this is coming from someone who has transitioned from bedside to education, and I have not looked back. If this has helped you, comment, like, subscribe, all of the things, as I will be posting more content on nursing and just my everyday lifestyle. Bye.